Getting a knee replacement surgery is an incredibly serious decision to consider, and putting all of your trust in your doctor and surgeon to make sure he takes care of you properly makes it even more scary. Luckily, by the end of this video, you will know exactly what your surgeon isn't telling you about getting a knee replacement surgery and what you can do about it. Paying attention to every single thing mentioned in this video will ensure you that your knee replacement surgery runs so smoothly that you could cut your recovery time in half. One of the things that doctors often forget to mention before knee surgeries is that being stronger before your surgery will actually make your recovery time much quicker. In other words, strengthening your hips, knees, and ankles will allow you to recover much faster from the surgery. Let's look at a few ways that we can strengthen your body before your knee surgery, allowing you to cut your recovery time in half. Most important exercise is at the end of this video, so make sure you watch closely. The first exercise is the glute bridge. This will strengthen your glute muscles and hamstrings, which keeps your hips strong before the surgery. Lie down on your back with your feet about 1 to 2 feet from your butt. Next, drive through your heels, bringing your hips up towards the sky. Try not to arch your back when doing this, completing 3 sets of 15 repetitions. Now, quad sits will strengthen your knee muscles more directly. For this exercise, sit down on a bed or a table with one leg straight out in front. Next, you will roll up a towel and place it under your knees so it elevates it slightly. Now, you will try to straighten your knee out, which will bring your foot slightly off the ground. Try to squeeze your muscle for a few seconds when doing 3 sets of 10 repetitions before going on to the next exercise. The next exercise will target all of the muscles in your lower body. For monster walk, start in a standing position with an ankle band around your ankles, which we will link below. Next, you will reach your right foot forward, slowly bring your left foot forward, and then walk a long distance before trying it backwards. Try to keep a distance spread on the band throughout the exercise for 3 sets of 1 minute of work. Before we can look at those next couple of exercises, I need to make sure you subscribe to our YouTube channel. If you want to recover quicker from your knee replacement surgery, we help individuals of all abilities with issues just like that, in addition to navigating the fitness, health, and gym industry. Now, slant board step-ups are one of my favorite knee strengthening exercises that will help you both before and after your surgery. For this exercise, put one foot up onto the slant board, which we will link below, gently bending the knee on the board numerous times. The goal is to lightly tap your heel on the ground before bringing it back up into the air. This is a very small range of motion exercise where you should be able to do about 3 sets of 20 to 30 repetitions before going on to the most important exercise. Now, one of the most important exercises to keep your knees, hips, and ankles strong before surgery are sit to stands. Grab a sturdy chair and practice standing up and out of the chair, slowly sitting back down for 3 sets of 10 repetitions. Do your best to try not to flop down in the chair, controlling the descent throughout the way. And if you're getting a knee replacement surgery, I'm guessing you're dealing with quite a bit of knee pain, which is why this video might help you with that. Otherwise, you can check out our low impact exercise program below, which has helped numerous individuals deal with issues like knee pain and strengthening the rest of their body. To tell me you're no good, I'm brushing away.